Hey, everybody. Today, we're going to cover a medical ethics case revolving anorexia and force feeding. And the clip that we're going to see is from The Doctors, which is a YouTube channel that covers medically related content.
A New Jersey judge made a life-changing decision in the case involving a woman suffering from anorexia and her parents. Have a look.
What do you do when someone you love seems incapable of taking care of themselves? That very decision was determined by a New Jersey Superior Court judge who ruled a 20-year-old anorexic woman was incapable of making her own decisions.
Okay, so the patient is 20 years old. So, under normal circumstances, this patient would have the authority to make her own medical decisions.
The woman asked the court for the right to manage her eating disorder on her own, but ultimately the judge gave her parents the power to begin force-feeding her in hopes of saving their daughter's life.
Okay, so it sounds like the judge appointed the parents to be the patient's guardians.
The case comes on the heels of a similar trial the same judge presided over months ago. There, he gave an anorexic woman the right to refuse being force-fed. Sadly, she was found dead months later from complications of malnutrition and organ damage. The judgment to take away someone's physical rights is definitely not an easy one. But at some point, do we need to determine the biggest threat to a person is themselves?
Yeah, that is a very good question, right? Because respect for autonomy is one of the main biomedical principles. But sometimes we think that people are not making wise decisions for themselves, right? So then the issue comes up, well, do we force treatment onto this person, right? And it's a big deal because we want to respect people. We want to respect people's freedoms. We want to respect people's rights. We don't like the idea of force feeding somebody. So it has to be justified.
I think we should preface this conversation with anorexia has the highest death rate of any psychiatric illness, but legally speaking, we are constantly confronted with some very difficult decisions. What are your thoughts on this?
This is a tough one for me, Travis. You have this 20-year-old young woman who wants to make her own decisions about her health, but you have the parents who are so worried. They're watching their daughter. At some point, she only weighed 60 pounds. Yeah. So as parents, you can imagine how distressing that was. And parents do have the right to go into court and to seek guardianship over a child and even an adult if they believe that person is incapable of making decisions on their own. So I have to applaud the parents in this case for saving their daughter.
I agree.
I'm sure that this judge made this very difficult decision based on what the doctors were there testifying like a psychiatrist would do.
Yes.
And I think
anorexia is a very serious psychiatric illness.
And of the mental health disorders, highest mortality rate, as Dr. Travis already said, about 10%. And I think from a personal experience, I'm a physician, my husband's a physician. We stood by and we watched my husband's sister die of anorexia at age 41. And the issue was competency, because anorexics are very bright, they're perfectionists, they're often very manipulative. And so this first young woman who was 30 and went before the judge and said, nope, I want to determine my own right, and he bought into it, and then she died. And I think you can't live with that. When you can do something to...
So the issue is about competency here, okay? In previous videos, I've talked about decision-making capacity, right? Having capacity and having competency are very similar, okay? But the difference is that capacity is assessed by a physician, whereas competency is determined by a judge, right? So a judge determines you to be incompetent, right? And you go to a judge when you want to appoint somebody as a guardian, okay? And the guardian is a surrogate, right? And it's generally the surrogate that has the most power.
To prevent
compelling plea that I can make that competent decision
on my own.
Whereas in fact,
they can't.
Well,
because they're malnourished. So from a medical perspective, you're not getting those minerals, you're not getting those nutrients, you're not making competent decisions, even if you come across as lucid.
So competency and capacity are similar in the sense that they're made up of the same subcapacities, right? So you have to be able to understand the medical information. That's one. You have to appreciate the circumstances. You have to be able to reason between the different treatment options, including non-treatment. And then the fourth one is that you have to be able to communicate your wishes, okay? Those are the four subcapacities that you have to possess in order for you to possess decision-making capacity.
Judge found in the case of this 20-year-old that she was delusional and that her judgment was impaired. And I think that was an important part in him making the decision, giving the parents guardianship over a 20-year-old, which wouldn't typically happen, and deciding that her parents should intervene and force feed her with the hopes that as she gains weight, and now she's gained 15 pounds, which is so amazing. But I want to ask.
Okay. So yeah, I mean, you can force feed somebody and have them gain weight, but what are the long-term success rates of that? I'm not sure. I don't know what the data says.
Ask you, Ariva, how this practically works. I'm trying to envision they go back home and the judge grants guardianship back to the parents, even though she's of an adult age at 20.
Right.
Because couldn't she theoretically go back home with them and individually fight them off as they're trying to, how does that, because it doesn't solve the family dynamic. I'm just really curious, because usually when you commit someone, you're committing them to potentially a psychiatric institution, formal treatment. This is a little different.
It is different, but in this case, that order from the court that grants the parents the right to use force feeding allows them to go to a hospital and have her involuntarily committed if they need to.
So it includes that ability to make that decision for her.
What is very unfortunate about cases like this is that physical restraints or chemical restraints are utilized. As far as I know, a lot of the times when they force feed people, they use an NG tube, right? A nasogastric tube. So that's a tube that goes up in your nose, okay? Well, for somebody who doesn't want to be force fed, what are they going to do? They're going to pull it out, right? And how do you prevent them from pulling it out? You physically restrain them or you chemically restrain them, right? And generally, we don't want to do that. Right? We don't want to restrain people. That's why it's so difficult. All right, so here are some final thoughts. The first thing is that patients with decision-making capacity have the right to refuse treatment, okay? Even if the treatment is life-saving, right? So imagine a Jehovah's Witness refusing blood products, okay? So that is the bioethical standard. Anytime that you are going to force treatment onto somebody, it means that they don't have capacity and you probably have approval from like a surrogate. But in this case, the patient was deemed to be incompetent, right? So the doctors will testify to the judge as like, yeah, this patient doesn't have capacity. And then the judge will deem the patient to be incompetent. And then the judge appointed the parents as the guardians. The other thing that came to mind is that I'm not sure how successful force feeding is. Like, of course, in the short term, the patient's going to gain more weight because they're being force fed and, they're being restrained so they can't pull out the tube, right? But in the long term, like, are there psychiatric problems managed? Are they resolved, right? Or are we just postponing the inevitable? I tried to look up the data, but I couldn't find it. So I can't really say what the long-term success rate is. But if the success rate is quite high, right, well, then that gives us more reason to pursue that path, right? If the success rate is very low, then it gives us less reason, significantly less reason to pursue that path. If any of you know more about what the data says, please leave a comment down below because I would really like to learn more about this topic. All right, I think I'm going to end it here. I hope you learned something interesting, and I'll see you all next time.